All right, and we're back, episode 19 of Modern Prescription. My name is Dr. Deepak Dugar.
And I'm Dr. Jeff Toll.
And today we're talking about some really cool stuff. We have your very close friend, Levi Powell, fourth-year dental student. Inspirational guy. What an inspirational guy. Yeah. He's going to be talking to us today about his journey, his path to becoming a dentist, and what he's going to do beyond and beyond that. And then also you guys' journey together with your trips to India, your medical mission trips, and how you guys kind of... changing the world one medical mission at a time.
Pushing each other to the limits.
Yeah, absolutely. I'm super excited. He's just a great guy to talk to. So I'm really excited for us to get into that conversation. We talk a lot about the inspiration behind how hard we all have to work to do what we do and purpose-driven lifestyles.
We need purpose out there. That's what's missing right now with COVID.
We need purpose. Well, stay tuned, guys. Great episode 19. Can't wait for you guys to hear it. Back, episode 19. So we're almost there, almost to 21. Almost legal.
Almost.
We're doing the healthy shots on episode 21.
I forgot about that. Healthy shots.
Healthy shots.
What healthy shot are you going to take?
I'm going to do kombucha.
Kombucha.
Yeah.
I've been drinking a lot of acerola recently.
Oh, tell me more.
It's a Brazilian cherry that has I think it's 4,000 times the vitamin C concentration.
Oh, so high antioxidant.
Yeah.
Oh, very cool.
Yeah.
Is this something you're doing in the morning?
Yeah, morning with breakfast.
With breakfast.
Acerola juice.
Ooh, that's so good.
It's kind of tangy. It's not sweet, really.
Got it. Yeah, there's a product that Dr. Kanodia loves called Amla, A-M-L-A. It's an antioxidant fruit in India. It's the highest concentration of any antioxidant fruit in the world.
Gotcha.
And so a lot of Amla juices, a lot of Amla pills, but extract powder of this product is the best in terms of antioxidant content. I know.
I want to look like Kanodia.
I know. Dr. Kanodia looks amazing.
He looks like 35 years younger than he is.
He is probably 35. I'm going to leave it at that.
Yeah.
He's a handsome 35-year-old.
Damn good looking.
This is my mentor, Dr. Raj Kanodia, the most famous plastic surgeon in the world, and by and far the youngest. We
had a great night out together.
We had a great night out. He loves you, and you love him, and it's a great camaraderie because all of us love to work hard.
Yeah,
and that's what we're going to get into a lot in this episode with your friend Levi.
Today.
But we all love to work hard, and what's cool about someone like Dr. Kanodia is that even though he's been doing it so long, he still keeps that same intensity every single day. He never feels like he's the old guy or he's the old. No, he's running just as hard as any of the young bucks.
He's talking about this new plan.
I know.
Right now.
I know. He's got the youngest energy in the room always. Yeah. But yeah, there's some cool stuff, weird stuff going on. You see the OxyContin thing that we...
Yeah, so basically the family, I guess, that started the company that made OxyContin was fined, I think, $8
billion.
Because
dollars.
It's kind of similar, akin to what happened with the tobacco companies, where there was internal documents in the company where they really knew how, detrimental it could be to society and kind of lied to the public about how addictive it was.
Yeah.
And so basically they sold people drugs that people were going to be stuck on the rest of their life.
Knowingly.
Yeah. And knowing you're going to get refills indefinitely forever for the rest of that person's life.
Right.
So they made a lot of money and they're going to give $8 billion of it back.
Yeah, from the company. I think the family was fined $225 million personally so far, and then $8 billion from the company.
But the destruction is
massive. I mean, what it's done to our society is massive. And I think it's one of those things, if you don't have a family member or know people who are affected by opioid addiction, it's kind of like the Black Lives Matter thing. If you don't have Black friends or Black family, you don't understand how devastating it is. Right. And so I think that people in those pockets of communities that are just being ravaged by opioid addiction, it's terrible. I mean,
we all see it. Everyone in LA, even if your only understanding of it is looking at the homeless problem.
Yes.
Yes. It goes so deep in different communities across the country, from rich to poor, it affects really everyone.
Yes.
So I think this is something the younger generation of doctors is extremely careful not to prescribe.
Extremely.
Post-op.
Yes.
A few days, it's reasonable. What it's meant, opioids are meant to treat acute pain for a couple days.
Traditionally, rhinoplasty surgeons after a nose job would give the patient 40 pain pills. I give my patients 5.
Exactly.
And most of them don't even take any of them. They just take Tylenol.
Because I think now the public understands that these are addictive.
Yes.
So most patients don't want to be on them.
Yes, and which is great because now it's a group effort. Doctors and patients all trying to get off of it.
But we still haven't solved. I think the medical community is doing a better job. I think people don't understand from a doctor's perspective. Let's say I get a new patient who's been on these for years. And they say, okay, my other doctor retired or whatever, or my other doctor told me they won't refill. Can you give me a refill?
Yes.
You run into this catch-22 where if you say no, someone who's on high doses of this OxyContin, what are they going to do? They're either going to buy it off the street,
right,
or potentially use heroin or something else to get the same fix that they need.
Which is the same molecular compound.
Which is basically what OxyContin is.
Yeah.
And a lot of people's street drug problem starts with pills that they were originally prescribed legally.
Right. They lost access to at some point.
Yes.
Right. And that's the hard part because it's catch-22, like you said. What do you do as a doctor?
It's very difficult.
And a lot of pain doctors, like the PM&R pain doctors, this is the biggest problem they have is because a lot of practices end up becoming pill practices where they're just prescribing pain pills to these patients.
Right.
But it becomes very dangerous because it's a very slippery slope. And that's the hardest part, I think, for a lot of these doctors.
Right.
So yeah, that's a little bit of sad news in the world, but it's good that something's happening and that these companies are now being forced to reconcile what they've created, the monster they created.
Whether for whatever reason the pandemic has gotten people enough time to look at the world and see a lot of the problems in the world, and there's a lot of reckoning going around.
A lot of reckoning. You saw this other study that they're saying mouthwash kills 99% of the coronavirus in the mouth. So that's a good thing to think about. So maybe we should all be doing mouth rinses a lot more, at least twice a day, morning and night, because I guess it's just the alcohol probably is what I would assume that's killing the bacteria and the virus.
I think realistically, unless it's how often are you going to get the virus just in your mouth and not swallow it and not get absorption into the body or whatever.
Yeah, so it's probably not. I hear a lot of people saying that if you just drink alcohol, it'll get rid of it.
According to Trump, if you drink Lysol, it cleanses the body too. So
I don't think he did that though. I think he did Resdemivir.
I think his doctor probably gave him that.
Resdemivir is now approved. That's an approved medication now.
I've used it on some of my patients.
You have? Okay. Yeah.
I've run into a little bit of side effects, a little bit of liver toxicity a couple times, but it's knock wood, we've had everyone that I've had on it has lived.
Great.
But I can't say that they wouldn't have if they weren't on it.
Great. That's a good point. That's a very honest, great statement because a lot of people just extrapolate that, well, I gave one patient Resdemivir, they survived. That means it works. They may have survived without it.
They may have been sick. They may have been sicker after taking it, then they may have been better faster without it.
Right. Absolutely. And speaking of side effects, so AstraZeneca COVID vaccine trial, they just announced that one patient in Brazil passed away from side effects of transverse myelitis, basically inflammation of the spinal cord. This is, again, very complex, right? When you're doing a trial on thousands of patients, you can't really
someone
pinpoint.
Has a very rare condition. So transverse myelitis, it means that someone essentially, like if you do an MRI of their spine, they'll have inflammation that is kind of like parallel to the floor. So it's transverse. It goes across the body and it takes out an entire part of their spinal cord. So a lot of times it'll leave you paralyzed below the level of the inflammation. So it's a very serious thing. And we do see it very rarely can happen from other viruses. Herpes virus, like genital herpes, you can get a transverse myelitis down at that level of the spine. But it's a rare event. This is a rare disease.
Very rare event.
And so for someone on that trial to get it is fishy that, it may be because of the vaccine. Right.
And also, I just feel like for the public consumer, you should not be scared about getting this. Because I saw so many people talking about memes and saying, oh my God, I will never get the vaccine now because of this. And I think that's just a terrible way to scare people and just create fear mongering. If and when the vaccine comes out after it's been tested and approved, I still would recommend everyone get the vaccine and understand that, yes, you might have some reservations. You might want to do it delayed, but understand that vaccines, generally speaking, are safe. And speaking of vaccines, everyone should get their flu vaccine. If you have not, I got mine. And I think these are the basic things that we have to remember as a society. We live in such a cancel culture, fear mongering, don't listen to authority. That is not actually what's happening. Science cannot just be ignored. And I think that's the problem that's happening every day.
I think my only caveat to that is, as I totally agree with everything you said, as long as we don't take the shortcuts on these trials and we actually give it the real scientific test. So it can't be just we want the vaccine to come out because it's convenient if it came out right now. We really need to wait long enough to know that it's safe and that I think we think agree. It works. Mm-hmm. Most of these vaccines look like they work. The question is the risk benefit there?
Right.
And it may be we find out the risk benefit is only right for people in the highest risk group.
Yeah, the 60 and plus.
It may come down to the fact that people over 70 who are at very high risk if they were to get COVID, that sure, there may be a small risk from the vaccine, but they're obviously better off getting the vaccine.
Right.
And that may be what science proves, but the science will bear out with enough time to study it.
Right. Absolutely agree. Could not agree more. Good. Well,
let's bring on Levi.
Yeah, let's bring on Levi. Let's bring on Levi Powell, soon to be dentist Dr. Powell. All right. We're back with almost soon to be Dr. Levi Powell, a close friend of Dr. Tolles, Fig's brand ambassador with you as well.
Yeah, that's how we met. I think like 4 years ago now.
Yeah, 3 years ago.
We met at it was like a yoga meditation retreat that the Figs people organized.
Cool. And they mix it up with doctors, medical students, dental students, Levi being a fourth year dental student right now.
Yeah, exactly. So,
nice.
Yeah, I mean, the actual group of ambassadors is comprised of all walks of medicine, which is really, really cool. I would say that I've learned the most about medicine from like all of you guys, which was sparked my interest also to apply to be a resident in a hospital and all that. So it's been an amazing journey.
Cool. And so are there nurses also and like nursing
students?
Yeah.
So
wow.
Kind of everything.
Like whatever you would see in the healthcare industry.
Anyone who wears scrubs, they have. So they even have like really everything, like x-ray techs.
Oh, wow. That's really cool. Yeah. Really inclusive of them to do that. That's really cool. Because most of the scrub companies just kind of just focus on doctors, which is so non-inclusive. Because I would say most scrubs are worn by nurses if you really break down the numbers. For sure. Yeah, by and far. Yeah. So Levi, tell us your ethnic background because that's really interesting. I want to start with that. Because you I can't exactly pinpoint it.
It's funny you asked that a question to start because I probably get asked this question at least once a week. And I'm not exaggerating, like for real. Yeah. It's kind of crazy. But I'm half Filipino, half black. My mom's full Filipino, my dad's black. So yeah, I mean that for me even growing up in kind of that dynamic was pretty, it was a pretty tough path at some points, like I'd be with my Filipino side of the family and I feel like I'm the darkest in the room. And I'd be with my black side of the family, I feel like I'm lighter than ever, So it was a really kind of interesting way to kind of, be raised and all that. But I think it was very transformative for just how I really have a lot of care for people across, different populations and all that.
And one of the ways that Levi and I became really close was traveling, doing like medical mission together. We went to India.
My favorite.
Your home country.
My home country, of course.
And so we went to a place called Manipur, which is in the eastern part of the country near Burma, Myanmar.
Yeah, far east.
In like these small villages. And so I was treating all sorts of like parasitic conditions, skin conditions, weird stuff. And Levi was pulling out rotten teeth. And,
wow.
It was pretty cool.
Wow. So you must have been a first or second year dental student?
So I was a third year at the time.
Oh, you're third year.
Because this was like
this is
less than a year ago.
So this was
cool.
This was in, I think,
November.
Like about 1 year ago. Yeah.
It was this with Figs as well?
Yeah.
Oh, wow. That's so
cool.
One
real good, we don't have to plug them anymore, but like one really great thing about Figs is that they're like similar to Tom's shoes. So every set of scrubs you buy, they donate a pair on the back end.
Oh, amazing.
And so a part of that donation process was us going on this mission trip. And this trip for me, because I've been on, we'll get into it, but I've been on 6 different trips now. That was my 4th one. And most of my trips are exclusively dental. So you said you work sometimes, doing trips abroad and doing like cleft palate, cleft lip, that kind of thing. Cleft palate, which is like really, really big, obviously, in community dentistry.
Yeah.
Usually the groups are very dental focused. Yeah. And so we only provide like comprehensive dental care. And if they have questions about like their, systemic, then we can't really do too much, but refer. Right. But this trip was different because it was multidisciplinary. We had 3 physicians, 1 PA, 2 nurses, and me. And we literally were like, Jeff and I talk about it all the time, but we were like the Avengers walking in there. It was it was crazy. It was insane.
Wow.
Like we had these crazy backgrounds in medicine and like all these great schools, and even past all that, because people who we're working with don't care about any of that. We have like skills to actually take care of what their issues were. That's what was so impactful to me.
That's cool. You say like the Avengers, because
we had a pediatrician, an OBGYN, myself, medicine. And then we had
internal IR, Michelle.
Yeah, interventional radiologist. She was actually doing bedside ultrasound. So we were like looking at people's kidney stones and
wow.
You know, it was really cool and really helped a lot of people. I think we were seeing like 500-600 people a day or something wild.
Yeah.
And was this a standing clinic that already existed and rotating people come in and out?
A few of the days we were inside of a pre-existing clinic. Then we actually did some days like out in a village where we were literally in a brick building that didn't have a roof.
Got it.
And we're just like one after the other. And what was cool is on that trip specifically, you know, a lot of people, we were sort of, because, you know, a lot of symptoms are very kind of cultural. So, and what I mean by that is when people are experiencing hard times psychologically, they tend to have certain sets of symptoms depending on what their culture is. So whether that means headaches, my stomach hurts, bowel issues.
Right.
Some of that is like culturally what you complain about when things are not going well for you, let's say. And they had a lot of stomach issues. And I initially thought this was like a cultural thing that people were complaining of stomach issues. But I found out also on the second or third day after I was talking to one of the local doctors that they were chewing on this, I can't remember what it was called. Beetle nut.
Beetle nut, yeah. Causes cancer, yeah.
And so this beetle nut they were chewing on was causing crazy things for Levi to see in the mouth. But was also probably causing really bad gastritis. So we brought a whole lot of medications and I ran out of PPIs, I ran out of Pepcid, I ran out of everything I had to give them some relief. And tried to explain not to chew the beetle nut, although I didn't think that was necessarily going to happen.
It's like they're chewing tobacco. Beetle nut's like chewing tobacco here in the States.
Yeah.
So like how we used to do back in the day. You know, I don't know how many people still do chewing tobacco, but beetle nut, same concept. You're getting that high off of it.
Yeah.
And so that's why the villagers chew it. But the problem is it decays the teeth, causes stomach issues, and most importantly, causes a ton of oropharyngeal cancer.
Yeah.
So oropharyngeal cancer is super high in those regions with beetle nut.
They look like Beetlejuice. It causes you to look like Beetlejuice.
The one controversial thing that people always talk about with medical trips, because I've done a lot of medical trips in medical school. I used to do like spinal train, Operation Smile. You go do cleft lip surgeries. The problem is continuity of care, right? So that's the big discussion. So it's creating more of like sustainable platforms versus the Avengers in and out team, right?
Sure. Yeah.
And so that's like always the big goal is how do you create a sustainable system in these countries that can be sustained without y'all's presence? And that's the hard part, I think.
I have a dope actually story about that. So again, I agree with you 1000%. All the trips I've gone on, it's like afterwards, it's like, okay, well, what do we do now? It's like if we place a restoration on a tooth,
right? Who's going to take care of it? Yeah,
you know, you do it down the street. You call your dentist and he adjusts your occlusion and then you're fine. You know,
right.
But here it's a completely different story. And so there's a bunch of levels to that in terms of like how we actually go about our care. So one of the things we do in these other countries is we do pre and post-op X-rays. So we do pre-op X-rays obviously to see the extent of the lesions and you know where we can help and what we can do as far as like heroic dentistry, because sometimes the teeth are just so bombed out that we can't do anything unless we can just, you know, pull it, unfortunately. But in private practice, we do the same thing. We take a pre-op X-ray, or in school for me, we take a pre-op X-ray, we'll do the filling, patient's okay, we check the occlusion, all that stuff. And if they're good, cool, go home. But there, we take a post-op X-ray. So we actually see what our work looks like after we're done before we dismiss the patient to make sure that we minimize that, you know, post-op pain or post-op discomfort.
And who would they go see if they had post-op pain or discomfort?
So that was a really, really cool part about this trip is that I was the only, you know, dental person on the trip, but I worked with a local dentist there.
Cool.
And so I worked out of her private practice because her uncle was like one of the main guys in the village who kind of like, Jeff and I are trying to figure out what he actually did.
Organizing the trip.
He organized it, but he was like
the godfather of the town.
He was like on some Pat Riley vibes for sure. But no, it was cool working with her because like she's 24 and I was 27 at the time. I'm older than her, but like I'm looking up to her and she's helping me with a lot of stuff. It was one of the most transformative trips for me because the first time in my entire life I actually felt like a doctor, even though I'm not claiming to be, but like
soon to be, a few months.
Soon to be. Thank you. But I felt like a doctor. You know, a patient comes in, and if I'm a hygienist also by trade. So if a patient comes in, I see something, I'm like, okay, that doesn't look so good. Write it down. Doctor, go and check this. Doctor does the, evaluation, the official diagnosis, write up to insurance. They bill it, all that, right? But here it was like, patient comes in, has an issue. Okay, Levi, figure it out.
Yeah.
The first couple of patients, I would like, oh, hey, can you like take a look at this? She's like, just do it. Like, why are you asking me? I got frustrated. And I was like, yo, like, this is crazy.
Right.
And it really like makes me like tap into like what I'm actually learning and how I'm learning. And it makes me, in a sense, like go harder at school to make sure I'm not missing stuff in private.
Yeah, I think that's such a beautiful transition that we all remember so well, that going from, student to doctor.
Yes.
And when, I round with residents still all the time. And one of the things, especially the interns, I try, the interns will be a little scared to and suggest that, hey, maybe this is the diagnosis or maybe, and I'll look at them in the eyes and say, well, what do you want to do, doctor? Because it's learning that like you're ready, you're smart, you're trained for this, you're ready, you can make the decision. You need to put your thumb on the scale and make the decision.
Yeah.
This is your patient.
Were you, when you were an intern, Jeff, were you very gunner? Were you like always knew the answers?
So
yes.
Not gunner in the sense that like I try to like put other people down or whatever. Yeah. But I was probably too sure of myself my intern year. And I definitely have a very funny time where I got into a big fight with my senior resident because we disagreed on what the diagnosis was. And on rounds, he wanted me to say what he thought it was because he thought it was going to make him look bad.
If you say the wrong thing. If I
said the wrong thing.
Right, because you would have run it by him before rounds.
Because you're supposed to run it by the senior resident.
Yes.
But obviously, I knew that I was right. And so basically,
were you right?
So here's the case. So it was this guy. It was a guy we knew had advanced HIV, like AIDS, basically, like very small immune system left, like 20, CD4 count of 20.
Wow, that's very low.
Coming in with very high fevers, but normal vitals. So he had blood pressure was like 130/80, heart rate was like 75/80, but high fevers. And so basically what I was trying to say is he probably has some weird atypical infection, either viral or atypical bacterial infection that would be able to cause a high fever. But if he had any, in my opinion, if he had any, if he had bacteria in his bloodstream with no immune system, you're dead.
Yes.
Like, so
especially with 20.
Especially with no immune system.
Yes.
So I was saying low likelihood that this is really, a bacterial, like sepsis or something.
Right.
And
also the vitals would be different.
Exactly.
Yeah.
Anyway,
you were right. The answer is you were right.
Obviously, he had like a virus. It was
like
the flu or something.
You were kind of a gunner.
No,
you argued with the chief resident.
I think that's part. I think, whatever specialty you are, whatever type of, and really beyond medicine, if you're a professional or if you're analyzing someone's business, if you're, you have to know, and you've talked about this all the time, how you compare surgeons to professional athletes.
Yeah.
You have to feel confident that you are the one to solve this problem and fix the job in order to get it done right.
Absolutely.
If you have any doubt, if you're an athlete, you miss the shot. If you're a surgeon, you mess it up a little bit.
Yeah.
And if you're an internist, you start sending people to 40 specialists because you're not willing to.
Right, and their condition can be worse.
And
in the meantime,
make it worse.
Yeah. One thing when I was in medical school versus residency versus now in private practice was for surgery, it's always very much about, again, having that confidence in the anatomy. So if you know the anatomy really well, you're confident. If you don't know the anatomy well, you're super timid because you don't want to cut the wrong thing.
Sure.
All of a sudden you can paralyze someone if you cut a nerve or something. Right. So in medical school, super timid. We didn't do anything. It's very like that's just how it is. It's just more about memorizing answers to impress people in rounds. Right. And then in residency, there's like these moments where like when you're being monitored by the senior surgeons, by your attending surgeons, you're kind of like in this comfort zone, but you're not really having any responsibility. So you're kind of chill, but then there would be times where they leave you alone with the patient. And that's when all of a sudden, like, responsibility just kind of like whoosh, kicks in. And you're just like, holy crap, I'm now responsible in this moment for this person's well-being. And you become so much more in tune. It's like all of a sudden you're seeing through the matrix and you're really careful about every move. But the minute the attending walks back in, you kind of lose that sphincter and you kind of go back to being like, all right, well, someone else is responsible.
And it's awesome because you've been studying for this moment for years. Yeah. And the thing is, in other countries, like you could probably ask that dentist in India, you probably already have more training than she ever had. and she just was probably trained with a mentor watching them and then as a dentist. Whereas you've been doing this for years and have reps in and all the stuff that she never had.
Yeah.
And so you were probably ready for it just as much as she was really ready. She probably got thrown into it when she wasn't ready.
Yeah, she definitely didn't want to be there. I mean, there were days where we would start at like 8:15, maybe sometimes earlier, and I'd be there till like 5, 6. Like I had a headlamp actually. Like we use loops in dentistry, just like you guys use loops in surgery. Yeah. And that's what I was using the whole time.
The magnifying loops.
Yes, exactly. Yeah, the glasses with little telescopes on them with a light on your forehead, so you can like have directional vision when you're working.
Yes.
And I was using that the whole time, and she was like barely wearing glasses. I was like, "This isn't safe." Like, it was kind of bizarre. But at the end of the trip, and I bought that loop light on like Amazon to bring it out there for like $30-$40. Right. At the end of the trip, I was like, "Listen, you can have this. Like, this is gonna like make your work a lot easier. Like, you actually see what you're doing, And she like literally broke down in tears.
Wow.
I have pictures. Like, it was amazing. It was a really amazing experience.
The local community dentist.
Exactly.
Wow. Yeah. In the village or whatever, in the local area.
And I think on the same token about follow-up care, at least on the ones where we were working out of the clinic, I was like really cleaning up their charts. A lot of them were like terribly misdiagnosed on some other things. And I was like trying to fix the chart so that when they came back to that clinic, they would have a better diagnosis for some of the
local doctors.
Yeah, for the local doctor.
Got it. Yeah, I'm amazed by the third world medicine because sometimes these doctors are just geniusly smart. They just don't have the resources and tools. Yeah, and they just don't have enough, the governments don't have the financial ability like we have in here in the United States to give them the support that they need, you know? And so it's like, I remember when I was working at this cleft lip clinic in India, we would start around like 7 or 8 in the morning and be there till 7 or 8 at night. And they would see literally like 300 to 400 patients in a day. And it's in and out, in and out, in and out. And it was just so boggling because, we're in America, we're used to, you see 20 patients in 8 hours, you take an hour lunch break. Yeah. It's much more scheduled because we have so much luxury here with medicine.
But I think in terms of like what you were talking about before about your relationship with, your attendings when they're there versus when they're not, I think for me at least, like that primal instinct of let's get it going really turned on.
When you were by yourself and responsible.
When I was by myself and responsible, when I was out there, when I like would literally be like I'm dripping sweat pulling teeth out. Yeah. No jokes. Like all the things, pictures and stuff, like that all looks great, but like I'm dripping sweat pulling teeth like all day nonstop, right? And then I take a look out the door and there's a line from like here all the way to that wall. And so at that point it's like I can't be like, okay, Levi, you're tired now. No, it's like let's go. Like kick it up. Like we're here for 4 or 5 more days. Let's help as many people as possible. Life's too short to not have an impact.
Yeah. And that's like, that's really, that sentence is beautiful because that's the whole point of what all of us do every day, right? We're trying to make an impact. That's the reason we're making this podcast right now and talking to whoever's listening right now because we want you to learn something and feel like there's a purpose behind it.
1.75 million listeners.
That's right. We're getting there. On
a serious note, though, like even because I listened to your guys' first episode, and one of the things that I took from what you said was that you turn down more surgeries than you actually do.
Yes,
and I was like, this guy is probably the biggest surgeon in Beverly Hills, right? Has people flying all over the world, and is turning down more work than he accepts because he really believes in what he does.
Yes,
and I just like hearing that. I was at the gym when I was listening. I texted you. I was like, that's absolutely incredible.
Yeah,
and seeing you like grow from where we were 3 years ago to like where you're at now with all your stuff, like all that is like absolutely incredible. And so for me at this point in my career, it just makes me hungrier. It makes me it makes me that much hungrier because I gotta get it. I gotta get after it. I want to be at a point where not that I can turn down work, but I know I'm so confident in what I do that I'm only gonna do it the absolute right way and make a living and impact doing it.
Yes, and the proper impact. You're not trying to make an impact that's one-sided, which is a lot of people trying to make what's called selfish impacts. Yeah. You want to make a double-sided equal impact, which means that you're gaining something, but they're gaining something, if not more, from what you're doing. So I think that's hugely important. So you're a fourth-year dental student.
Yeah.
Tell us the path. How did you end up getting into dentistry? Why did you, was your family in dentistry? Did you have any mentors who told you to do it? Like, how did you end up here?
Yeah. So this story is like a very kind of long-winded one for me, but I tell it pretty consistently. And it I think the biggest thing for me in terms of my path to dentistry was my mentor that I found when I was 12 or 13 years old, my orthodontist. Dr. Griggs, he's in Castro Valley, California, up in the Bay Area.
Dr. Briggs?
Dr. Griggs with a G. Yeah, Griggs
Dr.
Orthodontics.
Griggs, shout out.
Yeah, the homie. But no, I saw him when I was like 12 or 13 years old.
And he was your actual orthodontist for your own teeth?
Correct, yeah. So me and my whole family. And he was my family's actual like first black doctor.
Oh,
so,
cool.
Yeah. So he the first time that I saw someone who looks like something like me in a coat and like have their own practice and kind of commanding that space, like I didn't know it at the time, but it was actually very, very impactful for me now that I look back on it 15 years later. Subconsciously, like seeing him do it and operate in his way and work well with his staff. Like, everyone at my high school went to him. He always had a new car, like every couple of years, new BMW. It's like, this dude is the man, and I didn't know kind of what that impact was going to have for me in terms of the trajectory of my career. But just seeing him do that really kind of told me that that's something that I can do too,
So that motivated you. Obviously, subconsciously, what did you actually do to make him your mentor?
Yeah, so I was interested in teeth. I don't know why. I always like looked in the mirror and brushed my teeth for 30 seconds in each quadrant and would
you have great teeth.
No, it was crazy. Like I don't know what kind of brought that on me. So that was kind of always out there a little bit. My dad's a fireman, so I wanted to be a fireman my whole life.
Oh wow,
yeah,
that's really cool.
So my dad didn't go to college. He went to trade school for a little bit, became an accountant, and then switched into the fire department in San Francisco.
Wow,
23 years now.
God bless him.
Yeah, no, and I looked at him and I was like, that's what I'm gonna do, like 100%. My dad's the coach of all of our sports teams and all. He's a dope dude, like he's amazing. That's what I want to do. But my dad told me, and I'll never forget this. My dad said, he was like, I did all of this and provided for me and my 3 other siblings with no college education, so you can go and get one and make something bigger of yourself.
Yeah.
I was like, I guess I'm working on teeth now. That's what I got to do. So in terms of Dr. Griggs, how did I actually go out and get it and make him my mentor and all that? I was an undergrad at USC, and I was interested in the dental hygiene program there. And so to apply to the dental hygiene program, you have to have some form of hours and all that. So every break that we had from school, I'd spend 2 weeks in his office and just shadow him, flip rooms, all that kind of stuff. And that relationship turned into my letter of recommendation for hygiene school, letter of recommendation for dental school, and we're still close to this day.
That's amazing. That's the same exact thing that I did. I shadowed my mentor, Dr. Kanodia, every single year. I'd spend 1 to 2 weeks ever since my second year of med school, and I did that for 10 years.
Amazing.
Yeah, and I just every single year I'd fly out to California, and all my friends would be going to like Tulum, or they'd be going to Europe. And I would just be like, I got to go to California. I mean, it wasn't that bad. I'm going to Los Angeles, but I would go out here and just spend a week, and I would just do it every single year consistently. And that's what a lot of the young kids, because I get asked all the time. Jeff and I both get asked by younger kids, like, how do we become like you? And the secret is you got to put the work in. I mean, it's really simple. And when you have mentors and you find good mentors, you have to put the work in with that relationship too. 100%. I get hit up on Instagram all the time by people like, hey, can you be my mentor? It's like, okay, sure.
What do you want to do?
Yeah, what do you want me to do? What's the conversation? Yeah, what happens next from this DM?
Yeah.
Do I just say, okay, and then they're just going to write my name down somewhere?
Do they say, can I come shadow you? Do they say, can I come
exactly.
Offer?
Exactly.
I think
it's about them figuring it out.
I think a good way is to offer something. So, hey, like, can I come shadow you? I'll help, do paperwork around the office.
Yeah, exactly. And I think that's the key, that they have to realize they have to give value add
100%.
in order to become a mentee for someone. Because no one's going to just mentor someone for fun. Yeah. It has to be value add in the sense that that the contribution I'm going to give to this person will lead to greater contribution to other humans. It can't just be a selfish purpose.
Because I think ultimately most people like to mentor someone, and it's like really fun rewarding to watch someone grow in front of your eyes that you help mold a little bit.
Yeah. Absolutely.
And that's we get value from that, but to start that process,
it's on them.
Someone's got to get the ball rolling.
Yes. And it's not going to be the mentor, it's got to be the mentee.
Busy. The mentor is very busy.
Very busy.
If this is someone who's somewhere difficult to get, they work very hard. Still,
yes.
Probably.
Yes, absolutely.
And I think in medicine, especially, is one of the fields where people have been working very hard and for many, many years. And it's something where people have the sight to be able to work hard for years without having money, without having the the title, they're working towards it for years and years and years.
Yeah, it's one of the longest paths in the world in order to become some of the specialties in medicine. I mean, 4 years of undergrad, 4 years of med school, between 3 to 7 to 8 years of residency. Yep. And at all this time, like you said, you barely have a title and you make no money. And yet you're still seeing a long-term vision through a little tiny pinpoint hole, with a little light that shimmers once in a while.
So you gotta
not
enjoy
even
the
every day.
journey. I think enjoying the journey, for me, it was, and I think Levi, I see this in you, it's like you get pleasure out of like seeing how hard you can push yourself.
Yeah.
Like if you see that, like I study even more hours per day right now, and I'm working after hours, like doing hygiene to make a little extra money and do it. Like those are all like making you who you are and making you more likely to succeed in the end. And it's going through all that challenge. Because I think, for some, I think what we've talked about in the past is culturally, for us.
Yeah, being Indian and Jewish.
We had the Indian,
upbringing
a lot
pushing
of
us for education.
How many of my friends' dads were doctors at Cedars when I was a kid?
Exactly. It's just around yourselves.
Yeah.
But what you were saying about the working hard and feeling good about it, like we used to say in medical school all the time, like, runners get a runner's high.
Yeah.
After you run a lot, you get a runner's high.
Yeah.
We got a study high.
It's kind of true.
And it's so true. Like if you study a lot and you really feel good about it and then you're like hanging out, taking a break for 20 minutes, you feel good.
Yeah.
Because you actually feel like you process so much information. There's some sort of chemical reaction that's happening when you're processing that information. It makes you feel good.
Yeah. So, I mean, to speak to that, I literally just took so in dental school, just like all other professions, you have to take board exams.
Yes.
So I took my written board exam. It's a 2-day exam, yesterday and today.
Oh, wow. Congratulations.
Thank you. Yeah.
Wow,
so
that's huge.
I've been
So you're on a
studying
huge high right now.
8 hours a day for the past 2 weeks. It's been a grind. I sleep 3-4 hours a night. It's crazy. But one of the, and I don't mean to bring it back to the India trip, but one of the things that Jeff and I would actually stay up, we would literally stay up at night talking about is just about like your fabric, like what makes you, you know? Yeah. And so for me, in terms of that hard work, that mentality, that drive, that grit, all that is just about survival.
Yeah.
Like if I don't do all the things that I have to do, if I don't study extra for this exam, I got to pay for it. I'm not going to pass this exam. I'm not going to pass this test. I'm not going to graduate. To me, it's about survival. If I don't do it, my back's against the wall always. And it's a weird position because I have this chip on my shoulder where I feel like I have so much to prove always, but then I can be reflective when I have a conversation with Jeff and he's like, dude, I see you and me, and that makes me wow, that to be even in that conversation, to be having this conversation with you guys is just such a huge privilege. And it just speaks to how you really can do what you want to do if you can work hard.
Yes.
And if you can connect with people, if you're adamant, and not badgering people, but if you're
value
on
add,
your stuff.
value
Yeah,
add,
exactly. So
yeah, and you being here right now, this is a great conversation that everyone that's listening is enjoying because you're offering a lot of value. It's not like we're sitting here trying to mentor you.
Yeah.
You know exactly what you're doing in life, and you're going to crush it. And that's what's cool about seeing the trajectory that students, especially like you, successful ones, are on. Because that's one thing I always used to say. We're all on the same journey.
Yeah,
it's just we're on different stages of it.
Mm-hmm. Yeah, and I think in someone entering into medicine or dentistry, that's a very difficult goal that they're putting ahead of themselves.
Huge.
But I talk about this all the time. When Levi and I have talked over the years, we've talked about this, how much effort you're willing to put in, what you're going to get back at the end of the day. But that's a microcosm of life in general and every other thing.
Yes.
And so at least for myself, when I see patients, right now, what's the biggest thing I talk about every day is everyone's stressed out, anxious, and feeling not good about themselves during COVID.
Yeah.
So today, I think in 7 conversations out of the 10 I had today was challenging someone to say, okay, you're feeling frustrated, you're having trouble sleeping right now, go exercise more, go walk more, go do something.
Right.
Because they're
choosing your hard.
I started talking to, a therapist, and I'm going to talk to them once a week. And I love therapy. I think it's great. I think it helps people to realize why they are the way they are, why they think the way they think.
Yeah.
But my common complaint with therapy, and I've said this before, is it never asks you to do something.
Right. It's the prescriptions you give your patients when you tell them, go on a walk, do these things.
I give
it's
a
not just
homework
medications.
assignment of, change the situation. It's the homework assignment. Yes, antidepressants can help get the momentum going maybe.
But you want them on the sunlight. You want them out on a walk.
Walk, sunlight, do stuff, like have a goal. Even like for someone who's retired, who's pretty isolated because they're scared of COVID.
Mm-hmm.
Well, what's a new hobby you want to pick up in a goal? You want to learn how to play the keyboard. You want to learn a new language. Like like if you're doing something, you're gaining a new skill and something, you're going to be happier because there's a purpose. There's a purpose.
Yeah, absolutely.
And so that's a lot of times depression is a lack of purpose.
Mm-hmm. Yes.
Because even someone who's working really hard but has a purpose is rarely going to feel depressed. They may feel tired.
Yeah.
They may feel like, can I keep it going? How long can I really do this? But they're less going to feel, in my opinion, less depressed.
Yeah. Well, I always say it's choosing your hard. Like I saw this great meme and they're saying divorce is hard. Marriage is hard.
Right.
Choose your hard.
Right.
You know, working out and staying fit is hard. Being really unhealthy and fat is hard. Choose your hard.
Yeah.
You know, there's all different types of hards. It's just you choosing which hard you want to have. But you got to work hard. There's no one in life. I don't think there's a single human being in life who doesn't have a hard life. I don't think anyone has quote unquote an easy life. It doesn't exist.
Right.
And so you have to understand that you're going to work hard no matter what. So you might as well do it in a very purposed way.
Yes.
Because we all know the deeper you have a purpose in what you're doing, it keeps you spiritually, energetically, emotionally focused, and also just gives you a drive every day. Like you're saying, you wake up every day and you feel like you have a chip on your shoulder, back against the wall. You got to do this for survival. Yeah. Most people would say, "What are you talking about? You're not going to die if you don't become a dentist."
But that's what.
That's the mentality you give yourself.
Exactly.
But that's like Michael Jordan, Mamba.
Yes.
That's like you. If you need to give yourself a theoretical outside,
because it's giving you an advantage. It's like Michael Jordan. They used to say he used to make up stories. Like on The Last Dance, they're saying that he used to make things up about other players, what they said to him, and they never said these things to him, but he used to make it up.
Talk about his mom, his girlfriend, all that stuff.
Because when he got on the court, he would look at them with just absolute disgust that I have to destroy you now because of what you said to me yesterday, and they never said anything to him.
And so I think for me, what that articulation is for me in terms of my education is not that I want to be any better, and I'm not being boastful when I say this. I don't want to be any better than the student sitting next to me, or the student above me, or the student below me. I really don't. I don't even want to be better than my attendings, my professors. I don't. I want to be the best that I can be for my patients. I want to be great at this for my patients.
Yeah, absolutely. That's the secret of being the best doctor possible. Honestly, I mean, you're going to obviously be a phenomenal dentist because you already know that, but that's the secret. It's about being the best version of yourself, because that's, you have to care about the patients in a deeper way. You don't look like, I do a lot of surgery. So I have patients who have post-surgical complications sometimes, right? They have bleeding or this or that. I don't think of it in the middle of the night at 1 a.m. like, oh my God, I hope patients don't call me because then I'm going to have to get out of bed and go see them. No, I think of it as, please God, protect these patients so they have a great, pleasurable experience, because I don't want them to have to get out of bed at 1 o'clock to go see me in the clinic.
And that goes back to, again, like the first podcast when you said, I choose to only work with these specific cases because I believe in this so much.
Yes.
Someone who's like, oh my God, I have to pay for this and my kid's tuition and my car note and my house and my rental property. Like, they're going to take every case they can, right? They're going to, and they're going to make as much money as possible. Right. And it's no shade to anyone who wants to do that. You can do that in business, in healthcare, in real estate, whatever you want to do. But in terms of like how I want to practice and how I want to like practice like my mentors, it's completely different.
Yeah. I think in our market, at least in Los Angeles, if you're really good and you're not just like a random name someone's finding on their insurance, like someone's purposely going to you because of the care you provide.
Yes.
If you're good, the great thing is that people are willing to pay a little more for that, and you can then become selective. And so I think some doctors, you can just do good enough and churn like a mill and churn people.
Mm-hmm.
But if people are really dedicated to their craft and whatever it is, then it just changes. It kind of changes the whole structure of how their practice runs.
Yeah, absolutely. It's dedication to the craft. That's all it comes down to. And that's what I love. You just said the insurance. On my insurance, I actually have some random physician's name. I go to Jeff, and it's because he's a phenomenal physician, and he actually cares and researches and thinks about it in a really deep perception. So that's what I care about as a physician, is going to other physicians who care about the patient's experience. Because when you care about their experience, you will do the greatest job you can do. Like, there's no question. It's 100%. Not about whether or not you're going to do your best that day. You're going to do beyond your best if you care about their experience, and that's the best part. So tell us, you're about to be a almost graduated dentist. So what's next? So what happens after dentistry? Because I think there's some misconceptions is that you finish dental school and now you're a dentist and you start working. That's some people do that, but there are other options. What are those other options?
I would say most. So most people do that. Yeah. So
4 years of undergrad, 4 years dental school, and then you're a dentist.
Exactly.
8 years. Got it.
Yes. And then you can practice as a doctor, a licensed dentist, DMD, DDS, whatever school you go to, in whatever area you want to preside in.
So let's say that's the end of the line. Then what types of things do you do?
As a general dentist, your routine stuff. So drilling, filling, cleanings. If you want to get like a little bit more savvy, you can do root canals in your practice. You can do implants in your practice. You can do kind of the more high level stuff. GPs can actually place braces too, but it's like, if you're a consumer, why would you want to go to someone who doesn't do it versus, the doctor you guys had on here a couple episodes ago. She's an amazing orthodontist.
Yes.
I will go to her and send all my kids to her. Like I wouldn't do it, that's what makes dentistry, I feel like really different than traditional, physician medicine, is that like you don't have to go and specialize in something. You can do everything, but if you choose to, then you're kind of relegated to only doing that type of dentistry.
Got it.
So what are the other specialties?
Yeah.
There's a ton. So there's 10 that are recognized.
10 specialties.
Yeah, 10 specialties that are recognized. Yeah, the most popular ones
almost
are
as many teeth as some people have.
I hope not. Oh, that hurts. The most popular ones are pediatrics, orthodontics, braces, endodontics, which is root canals, oral surgeons. They, pull teeth, do pathology, surgery, all that kind of stuff. Oral pathologist is one. I want to specialize in the newest one, which is dental anesthesiology.
Ooh, dental anesthesiology. So what does a dental anesthesiologist do?
So just like traditional anesthesiology, we would work in either an outpatient or a hospital setting, and we would do the anesthesia for the case, and we wouldn't provide actually that we'd be working with a pediatric dentist or a periodontist or an oral surgeon, and they would actually do the work while we monitor the patient.
Oh, wow. So you would leave the craft of dentistry technically and get into the craft of anesthesiology.
Yes.
Got it. And so you would be doing an anesthesiology practice in conjunction with a dental practice that would be providing the dental care.
Exactly.
Wow. So what makes you want to leave the art of dentistry?
So I actually love dentistry. I really do. I like working with my hands a lot. I like working with people. I like connecting with people. But why anesthesia is so powerful for me is because with dentistry, the patients who need anesthesia the most are, pediatric patients who are kicking and screaming at the dentist, who are special needs patients who can't sit there for a routine dental visit, someone who's extremely needle phobic, right? Yeah. So those populations of people, it's a snowball effect. They don't go to the dentist because they're scared. When they go, they have a lot of work because they haven't been there in a long time.
Wow.
Couple that with, if you have a lot of work and you haven't been a long time, it hurts, we try to be as nice as possible. And so that subset of patients literally is just casted away. They're not seen, that there's no real outlet for them. And for me, dental anesthesiology is really a way to tap into that population and not have an answer for why we have to say no to someone. I mean, obviously barring any, pre-existing health conditions or things that would, counteract anesthesia. But across the board, if a kid who hasn't been to the dentist in 6 years has bombed out teeth, they're all black, you can't see them, they can't eat, they can't chew, they're getting sick because they're not their nutrition's off.
Wow,
that patient needs dentistry.
Wow.
And for me, it's like there's so many kids, so many people out there who need that service. But as we mentioned earlier, there's not that many programs. And so it's about just gaining more skills so I can help more people. That's my thing.
I think some people would actually choose to just get anesthesia, or at least some, maybe not a full-on general, but some sort of twilight.
Gas or something like that,
some gas or something for like more routine stuff.
But most, let's say you're doing an implant. Was that under general or is that all under local?
For the most part, it's under local.
Wow.
Usually people can tolerate that. I mean, it depends on the patient.
What's
obviously
interesting is in medicine, and you could probably speak to some of this, is there was a while where every routine case for even colonoscopies, they were putting people under. And now it kind of swung the other way where they're trying to do more spinals and
nerve
blocks and gas.
Yeah.
But I think with teeth, I agree with you completely that people who need an implant, and an implant is like where you have to like put a screw into the jaw, right? Into the bone. So it's very painful.
Drop a screw,
And people were doing that with nothing. And medical non-dental procedures that are much less invasive, we're actually getting anesthesia.
Yeah.
Right.
So that makes sense.
Yeah, that makes sense. Yeah.
So there's different levels to it, obviously. Like sometimes it's at school, for instance, we do it under local because it's like the patients don't really have a lot of money and they can't really afford the extra cost of the anesthesia and all that. So we'll try on local first. If that's not good for you, then we'll, try to do maybe moderate sedation, right? Not like always completely full GA. Right. But the patients who need that, the patients who have like no teeth to even chew, or their primary teeth, their baby teeth are now affecting their adult teeth because everything is so bombed out. Those are the patients that need it the most.
Oh, wow.
Yeah.
Very interesting. And then tell us, what has it been like during COVID as a fourth-year dental student? Because fourth year, I'm assuming, is a lot of clinic.
Exactly.
And so did you miss a little chunk of that? And how's that going?
A little chunk. Crazy. So like the rest of the world, we shut down in March.
Okay.
So I remember I was in another country and I was on a medical mission like during the actual shutdown.
Where were you this time?
I was in Dominican Republic.
Wow.
Yeah. Bright Island Outreach. Yeah. Really, really cool group of guys. We were doing a mission trip in the DR and I was doing dentistry there. Listening to the news. We don't have TV like that. And I just heard on, Tuesday, no NBA. Wednesday, no sports. Thursday is the pandemic. And I'm like, how am I going to get home? My mom's calling me. My mom's texting me. She's like, Levi, you shouldn't have went. You shouldn't have gone. I was like, Mom, I just want to help people.
Your Filipino mom.
My Filipino mom. Might as well be a nurse. Tell me But yeah, so that's when we shut down, which was crazy. And everyone was like, okay, we'll go back in 2 weeks. Okay, we'll go back in a month. Oh, we'll be back in June tops, And so it was like this compounding effect. And at a certain point, we're like, okay, what's really going to happen? Mm-hmm. And now, obviously, hindsight's 2020. Like, we lost 6 months of our senior year in dentistry, in my dental education, where we would have been, again, like you said, getting those reps in, doing composites, doing directs, doing root canals, all that stuff. And it's tough because my classmates who aren't applying to specialty, the ones who are going to graduate in May
and go to practice,
like that sucks. It really, I mean, if I don't get into residency, then I'll be in the same shoes, but hopefully I get in a month and I'll find out. But it was tough. It's really tough.
We're very confident in you.
Thank you.
I'm just sad you're going to out of LA.
I know,
probably.
Oh, because this fellowship's not in LA potentially?
The programs for anesthesia are all on the East Coast.
Oh,
I applied to schools in New York. So
New York, great place. You'll be very happy there.
He's just bitter at that Lakers win, I think.
Not a Lakers
He's
fan?
at Golden State.
Yeah.
You're a Bay Area guy. Yeah, that's right. Yeah. That's right. It's okay.
I think we're going to probably see each other in the playoffs next year.
Yeah, we're going to win.
I think so. I saw a meme and they were joking around LeBron smoking a cigar and they're like, LeBron thinks next year is going to be so easy, huh? And they show Steph Curry and they show Kevin Durant and they show everyone who's coming back next year.
Gone.
Yeah, it's fine. We have the number 2 pick. Andrew Wiggins, I think, is a hooper for sure. And then we have 3 All-Stars.
Steph Curry,
Klay Thompson, and Draymond.
If you're hoping for Andrew Wiggins to help you,
I don't even think you need
lost your mind.
We'll see what he does.
Lost your mind.
Just Klay, Draymond, and Steph is
number
enough.
2 pick. We flipped that for some assets, but we'll see. We'll talk basketball later.
Levi and I have a lot of sports competitions. So we've played each other in every sport. Also, actually, really cool one day in India, we're walking back home through the village.
So dope.
And there's these kids. They were probably like high school aged.
Mm-hmm.
It was at the end of a long day. It was probably 6 o'clock. Sun was setting, 7 o'clock, whatever it was. They were playing volleyball.
Cool.
So Levi and I see these kids play volleyball. We can't speak. We just start pointing like, okay, to play. We're literally in scrubs. We walk onto the thing. And we start playing, and we get into like a big 5-on-5 volleyball game.
Yeah,
wow.
Literally,
these kids.
I don't know how they did it, but they like signaled other kids from other like not neighborhoods, but like little towns and stuff to come. And when we got there, it was like 3 people, like 2-on-1 versus playing volleyball, and then it was like 3-on-3 with us, and then it was like 10 people all of a sudden.
It was a 5-on-5. We played for 2 hours.
Yeah.
Wow, that's amazing.
Dripping sweat.
Yeah, were you guys on the same team or opposite teams?
Same team.
Got it.
Because we can only communicate with each other. Like, if I want someone to pass me, I couldn't say anything.
I think that you were allowed to high five back then.
Yeah.
Pre-COVID.
True.
Pre-COVID high fives.
That's amazing.
It was great.
That's a great bonding story, though, to be able to go on a mission trip like that, because you guys are serving such a deep purpose together. That bonds you for life.
Yeah, for sure.
So that's a really cool story.
We had a great group, I think, in general on that trip. But
amazing.
More mission trips in the future?
Yeah, that was my second one. So I did another one in Honduras. That one was cool. I speak not good, terrible. I would say sort of terrible Spanish, like 3 out of 10, 4 out of 10.
Yeah, medical Spanish.
Good enough to get by.
Yeah.
So on that one, I could actually speak a little more. On this one, I had a translator. There was like a local nurse I was translating.
In India,
it makes it a little harder.
Of course.
But I would love to do some more. Yeah. No, I think it's really rewarding. I think I agree that it sucks that you can't follow up and stuff like that. But I really do think if you're going to give a week of your life away to go help, like literally hundreds of thousands of people, you feel great about it.
Yeah. And also it's like in terms of dentistry specifically, right? Because I can't really speak to like how you guys are diagnosing and treating patients and, Chandler and Laura, you got nurse, amazing, right? But for us in dentistry, a lot of the teeth because primarily I was doing extractions. I did a couple fillings on kids, like more aesthetic stuff or like small things that you don't want to take out a tooth prematurely because then it messes up the rest of their occlusion for the permanent teeth, right? So for me, a lot of the patients who I was working with, they've had like abscesses and like bombed out, broken down teeth for years. So they're going through this pain and really they can't eat or whatever, and it flares up, goes down, flares up, goes down. But like we're able to put them out of misery that they've had for 2 or 3 years. And so I completely agree that it's like, it sucks that I can't just move there for a year and build something up and, like establish a fully fledged practice. But I think like Jeff was saying, the little help that we can give, I think really is impactful.
Yeah. No, I think that's beautiful.
We bought a lot of ice cream to make that ice cream guy smile.
Nice. Yeah,
Jeff made fun of me.
Local economies.
He made fun
we
of
were
me.
giving all our money. We had some Indian money and we spent it like whatever we had left in the village.
That's
but it was just ironic. It's ironic that like this American dental student is going to India to go help them with their teeth, and I'm giving them cavities. What are you doing? Jeff was like, Levi, what are you doing? Taking videos of me. That was funny. That was good.
And Levi, last question: do you floss?
Of course.
We're taking a straw poll.
Yeah, we're trying to learn.
Is the floss that's in between the little sticks adequate, or is not as good as a real floss?
So you guys aren't going to catch me up because I listened to the podcast with the orthodontist. I heard the recommendation. I agree with the recommendation that it's good enough because it's better than not flossing, obviously. But a string of floss, the reason why it's better, and this is from a hygienist perspective, the reason why it's better is because it adapts around the tooth better. So that little U that you're using is not flexible; it's very rigid.
Right.
And so with floss, the whole goal is to get floss underneath the gums and pull out bacteria, not through the contact of the teeth and pull out your steak from last night.
So I think that's a big misconception. I think a lot of people use floss just to get out the mango and steak out of their teeth.
Oh, that's not what it's for?
Yeah. I had a mango last night and had all this stuff in my teeth, so I had to go floss last night.
Yeah.
It's a good session.
Yeah, or like ribs or something.
Yeah, but I guess I don't think of it in terms of the microscopic that you're trying to clean bacteria from under the gums.
Does mouthwash help? What about mouthwash?
It does help for sure, especially if it's like has antibacterial properties to it for sure.
You actually put me on an automatic or a electric toothbrush. That's great.
Yes. Game changer, right?
Yeah, that was great.
And now when you don't brush your teeth with electric toothbrush, it feels different.
The only annoying thing is if you're trying to like watch TV or like do something and you can't hear it.
It's loud, yeah.
It's too loud.
Yeah, I kind of miss those old days of the soft toothbrush. You can take a break, you can just pause, you can hold it in your mouth for a second.
Yeah, you like chew on it for a second.
Yeah, you can't do that anymore.
I was a big toothbrush chewer.
Like,
it would just get mangled up within a few weeks.
You have great teeth too, you're lucky.
You can't see my teeth.
Yeah, whenever you do a big smile.
Yeah.
Jeff's a half smiler.
Just at you.
Oh, well, thank you so much.
Yeah, thanks for being
Future
here.
Dr. Levi. We really appreciate you being on the show and you giving us your great insight because, people don't understand that just being a doctor, having the title doesn't mean anything. It's about all the years of work you put in before. So you have all of our respect and we wish you the best in your career. And I know you and Jeff are going to continue your competitive sports for the rest of your lives. And I wish you all their best beating Jeff.
Yeah.
You could be the referee.
Yeah, I'll be the referee next time.
There we go.
Yeah, I'll even let you cheat once in a while just to beat Jeff.
Hey, like you said, if you're not cheating, you're not trying, right? No, but thank you guys. I really appreciate it.
Yeah, our pleasure.
For me, I said it earlier, but for me, like growing up, none of this stuff was even conceivable. Like I didn't think about becoming a doctor or any of that. And to sit here, like literally looking at the Hollywood sign in Beverly Hills with plastic surgeon, internal medicine, like it's truly such a humbling experience for me. So thank you guys.
You're really an you don't realize that you're an inspiration for your community and, where you've come from and all that you've done. And I think not just from that, but just your mindset and how you see the world. So people listening, if there are students out there, this is someone who has like really got above and beyond and tried very hard to get where he is, and it's inspiring.
Yeah, very inspiring.
Appreciate it, guys.
Yeah, absolutely. And one day you'll be that African-American orthodontist. You'll be your own version for some kids too. And that's the coolest part, because that's how the world keeps going around. You keep giving back. So great work.
Cheers. Thank you, guys.
Yeah, thank you for being here, Levi. All right, and thanks for joining us on episode 19 with soon-to-be Dr. Powell. That was a great episode.
Great.
Yeah, that guy is inspirational.
I'm going to work harder tomorrow.
I'm going to work harder
Every
right
time
now.
I talk to Levi, I work harder.
Yeah. Well, anytime I need to listen to listen to this podcast again.
Well, that too. But, I gotta figure out how to make Levi keep looking up to me. So I gotta keep working on it.
Yeah, that's true. Because once he is a dentist, then he's no longer going to have that authority. You don't have that authority on him anymore. Right. That's a huge problem we have. You gotta figure this out. But thank you guys for listening. Please like, share, subscribe. Send this to your friend, especially if you have anyone in your family or anyone who's thinking about going to dental school, medical school, nursing school, any kind of higher education. This is a great inspirational one for them to listen to. So thank you so much for sharing, subscribing, and listening.